Hi guys, can you hear me? So sorry we're running late. Can anyone hear me? Yes, all right, thank you. Everyone, thank you so much for tuning in. We are having such a great week in the office today. We are doing some really exciting studies, and one of our studies that we did 3 years ago just got published in a really prestigious laser journal this week, and so that's been a huge win. And we just had like amazing patients already this week, and our PA Katie is back from maternity leave. So it's just been like a really great week, and I hope you guys are having a great week as well. And thank you so much, Alexis, for the compliment on the lip color. So it's nice to put lip color on because I'm not wearing a mask for this webinar. Okay, so let's go ahead and get to the good stuff here. We are so excited about this webinar. This is a very cheesy picture I'm noticing. So, how to look more awake and refreshed without surgery. Yes, please. Who is with me in that feeling? We are coming out of the COVID pandemic. The COVID pandemic has aged us, and now we're kind of getting back to like being busy and running around, and maybe we're not sleeping as much as we should. Maybe we feel like we're really aged, and we feel like we look tired, or we feel like we just don't look like we used to. And I went through this myself, and I actually still go through this, but there was a point before I did a few things where I was at meetings, or I was with Heather, my marketer, and they were saying, before they're taking pictures, they would say, okay, open your eyes really big while I take this photo. And so basically my eyes were normally little slits, and they were telling me to open my eyes super big, and it resulted in some pictures of me looking kind of crazy. So, but then I had some work done on myself, and I feel super rejuvenated. So I'm going to show you how you can rejuvenate yourself very easily and with minimal invasiveness. Okay, so this is a combination of treatment. We've been into combinations lately because we have so many tools in our toolbox. Why not combine them for the best possible result, especially if the modalities are safe and effective? So today we're going to be talking about filler around the eyes. We're going to be talking about neuromodulators, Botox, Dysport, their competitors. And we're going to be talking about a fairly new product called Upneeq. Has anyone ever heard of Upneeq before? And hold that question, because I thought Upneeq was next, but actually filler is next. So we're going to talk about filler for bright eyes, for looking youthful, for looking more awake, and looking like the pandemic never happened. So filler can be placed in the tear troughs. So the tear troughs, and is this camera on me? No? Is this camera on me? Okay. I just can't see myself, but I can't see myself. But if you can see me, the tear troughs are this area right here underneath the eyes, and it gets hollow over time. There it is. So it gets hollow over time. And if we're not well rested, it can look deeper. As we age, it looks deeper because we lose our tissue underneath here. We lose fat, we lose collagen. So it becomes more hollow over time. So what I do is I place filler underneath the skin, and it will raise the skin so it's not as close to the blood vessels, not as close to the bone. It will not shadow when light falls on it in a certain way. And it will also not be as close to the blood vessels, so it won't reveal that reddish purplish discoloration underneath the eyes. It's funny, I just received a text message from one of our staff members this morning. I don't know if she's watching or not, but she is like the most beautiful young woman, and she has camouflaged these dark circles so beautifully. But she sent me a picture without makeup, and she is a candidate for this tear trough filler. And so this can affect everyone from 20-something-year-olds that, just genetically have this to almost everyone as time goes on. We can use a little filler under here. Additionally, when we fill in the apples of the cheeks, this is something that I'm going to have Dr. Yonan do very soon. So when we fill in the apples of the cheeks, it raises up, it supports this area, and it automatically will make the tear troughs look better. So we have photos of that later, and sometimes we don't even touch the tear troughs, and sometimes initially we don't touch them. We might do things in 2 phases, or we might not need the tear troughs after we treat the apples. Okay, so here's an example of a woman who I did tear trough filler in, and this was only her tear trough. So you see before, obviously, and on the right, this was, I believe, after 1 syringe of filler. So 1 syringe, it will last a long time in this area, 1 to 2 years, sometimes even longer. It depends on the person, but at least 1 year in this filler or in this area. Here's another. This is a very young patient, but look at that little step off she had between the cheek and the tear trough. Look at the discoloration you see on your left of the area under the eye, and look how that's improved right away. This picture is taken immediately afterwards, and with tear trough filler, things kind of rearrange. The filler attracts water, the skin rearranges, so things look its best 2 weeks after the filler, but even in this immediately after picture, we can see the improvement. Here's another photo. This, I believe, is Dr. Yonan's result, actually. And so you see that deep tear trough on the left, and then on the right, you see how really beautiful it's smoothed in. And even though she's so young, it just looks so much better and more youthful. And by the way, some of you guys might say, oh my gosh, she only shows pictures of like these young, beautiful women. But a lot of times it's our staff we're showing. So, we treat patients of all ages, obviously, but many of our staff are young. And so they consent for us to use their photos on the webinar. So we can do this for anyone. Okay, here is a patient where we treated her cheeks. So you see on the left, look how her cheek was starting to, even though she's so beautiful, starting to come down a little bit, starting to sag a little bit. It's pressing down on this nasolabial fold. So it's almost like you want to pinch this area right here. On the right hand, the after, we have lifted the cheek. We have created contour. Look at that beautiful contour. Look at the light hitting her cheek and just contouring itself with no makeup, just our normal after photo, which aren't meant to be flattering. They're just meant to be objective. I would tell patients it's not a glamour shot, but look at how lifted and more youthful that is. And then look at that tear trough area. We also filled the tear trough. And so look at the tear trough area where you can imagine in a frontal view, it might look like she's aged here. It might look harsh here, but on the right, she just looks so youthful and fresh. And again, here's an example where I did cheek filler, and you see this woman. She's, again, quite beautiful. She is young, but you are starting to see her tear trough. You're starting to see a little crease here. I did the apples of her cheeks. Look how much fuller and tighter her skin looks. And she doesn't even need those tear troughs anymore. So it's really fun. This is one of our pictures you see a lot on our before and afters. It's our beautiful esthetician, Meryl. She's absolutely gorgeous. I didn't think she could get any more perfect. And you see, by doing cheek filler, those tear troughs just went away. It lifted her whole face. And we no longer even look at these little tear troughs. We're just looking at those gorgeous contoured cheeks. So sometimes we don't even need the tear troughs. We just want cheeks. So here is another staff member. I did a few things for her. So we did the Agnes treatment, which is something new that we're adding. And we'll talk about that in another webinar. But so you see her skin tone has dramatically improved. And then we treated an area under her chin. We treated her jowls a little bit. That's unrelated. Look at her cheek and look how I lifted her cheek. And then I just put a little bit in her tear trough. I didn't want to do too much in the cheek and the tear trough at the same time. But this is after one treatment. She had a lot in one day, but she looks absolutely amazing. She looks even better in person. In my opinion, she looks 25 years younger. And again, this is several modalities, but you can see her cheek in a very natural looking way is lifted and the tear troughs are improved. All right, another gorgeous patient. She had filler in her cheeks. And she also had some Sculptra in her cheeks. Again, we mix and match a lot of times, but you can see by lifting her cheek, her eyes just look more youthful. Her whole face is elevated. Her face over time, for all of us, it starts to look a little square in the bottom. Now I'm focusing more on her cheeks. I'm not noticing any squareness, which looks masculine on the lower face. I'm looking at the upper face and noticing her beautiful cheeks. Okay, let's talk about Botox, Dysport, Xeomin, Jeuveau, neuromodulators for bright eyes. So when we do the Botox study, I remember one study we were doing and we were putting a neuromodulator here, we were putting neuromodulator here. And these patients, when we took their after pictures, they literally looked like they had brow lifts, some of them. That's because doing the frown lines, doing the crow's feet, only with neuromodulator, popping a little bit of Botox there, it takes 5 minutes. It will give you an amazing lift for many people. So it just makes us look less tired. And I'm not talking about the Spock look. That is not what we're going for. We're talking about natural look in this area. In this area, we lift the brows, makes our makeup easier to put on, makes us look like we have an extra hour's sleep, makes us look 3 years younger. Very, very quick and easy. Botox and similar will last 3 to 4 months. Very easy to do. And it's just fabulous. You can see some cosmetic results here. And then cosmetic, and this is the forehead. This is not the frown lines, but you can see what Botox or similar can do in these areas. There are the frown lines. Doing those frown lines also raise the brows. Look at her after pictures. Look at like how her brows just arch and look, her eyes just look more awake. She looks fabulous. Here's a male patient. There's treating the crow's feet. He still has those masculine lines on the right, but they're just much less. And we're slowing down the rate of aging, but we're still giving him a nice natural look. Again, look at the frown versus after. Look how her eyes are so nice and alert and just elevated just a little bit. And again, Botox before and after. Okay, finally, let's talk about Upneeq. Upneeq is an eye drop. So this is a drop that you can put in your eye, and it is for what they call acquired ptosis. So basically our lids just get heavy over time. And so it lifts your lids, it opens your eyes. And actually, we're gonna put a drop in Sandra, our model today. And then we're gonna post the before and after picture. So we're gonna take a before picture. I'm gonna put the drop in. I'm gonna do the filler. You'll see if you notice an effect. Usually this takes effect about 15 minutes, but most of the effect is after an hour. So you'll see if you notice an effect as I'm doing the filler, and then we'll also post some before and after pictures. So super easy to do. So basically, how do you know if you're a candidate for this? Your eyelids come and cover a part of your iris, which is the color of your eye. So it's the colored part around the pupil or the dark part of your eye. So if part of that is shaded by your eyelid, this will stimulate your eye to contract. It stimulates your Mueller's muscle. That means this muscle right here in your eyelid, it'll just perk up a little bit and it will work for about 8 hours. I tell patients it's kind of more of like a makeup concept, whereas what I just talked about is anti-aging. It's going to have a longer lasting concept. It's going to slow down aging. This is more like makeup. You put it in, it wears off. It does nothing for the long term, but I have patients who wear it daily. I have patients who put it on before an event or a weekend. It is fabulous. And I use it myself. I should have put it in today, but I forgot because I had a 6:10 a.m. research patient. So I could probably really use it right now too. Maybe we'll do my before and afters today. Um, so here's some Upneeq before and afters. Again, this is a drop that's a medicine. It's been FDA approved for years. It's put into the eye and it stimulates the Mueller's muscle to contract and open. So before and after, this is 4 hours. The 4 hours probably like the peak. Here's a picture we had on our social yesterday. Staff member here. Here's gorgeous photo. Eyes are open. Actually, the whites get a little bit whiter as well. So that's super cool. Before and after, these are all our staff members. Okay, so thank you for taking your valuable time for attending today. You are going to be entered to win these prizes. So Upneeq, 3 treatments, Botox, enough to treat around your eyes, and then an awesome, awesome skincare package from a brand I love, which is ZO. Here's the promo. This is for a savings of $300. You will have 1 syringe of filler to do around your eyes or to do in the cheeks, whatever you need, and we will help guide you on this. You will, get Botox, enough to use around your eyes, 30 units, and a full box of Upneeq, 45 treatments that will get you through many weekends or many special occasions, or you can use it daily for, a month and a half. I love this Upneeq, and I actually, I took it on a family trip, and I made my brother and sister-in-law put it in, and then I took their before and afters, and we were kind of out in the middle of nowhere, so it was really funny. We were like posting the before and after, or putting them side by side, and I couldn't believe the results actually for both of them. So I'll post their photos a little bit later today too, but you're going to love this Upneeq. So if you're curious about it, I'd love for you to try it. If you don't want to do the trio, a box is $250. Box is $250. So it is prescription. So if you're an established patient, just let us know. We'll prescribe it for you, ask you a few screening questions. If you're not a patient, we need to make you a patient and prescribe it for you. All right. So you can commit to this purchase today, and you can bank it and use it when you need to. You can get the Upneeq right away. You can do your Restylane and Botox before the holidays, before a trip. We ask you use it within a year, but I have a feeling most people could use it before then. So this is good for Dr. Yonan and myself. So you could call and purchase the number on the webinar, our office number, our cosmetics number. Email the cosmetic email line and email address, and we'll call you back. Also, I want to throw in a little additional benefit. My marketing team loves to hear that. They're going to kill me. Savings of $400 to take $100 off of that if you book with our nurse injectors, Rochelle, who's coming back from maternity leave in a couple of weeks. Can't wait. And Emily, who is also who's our newest nurse injector, and they are both fabulous. So taking $400 off, an extra $100 off if you do this Bright Eye Trio with one of our nurse injectors. So you have to commit today, and this is only good for you, and you can pass it along to your friends and family members, but you are passing along to them. You are doing them a huge favor, and so you get the credit for that. So you can pass it along, but this will not be available for our patients who do not attend the webinar. Okay, so we're going to do our live demo. I have the most beautiful staff member today. Her name is Sandra. She is amazing. We're going to start with a drop of Upneeq in each eye. We'll show you her eyes first, start with a drop of Upneeq, and then we'll discuss her consultation. So give me 1 second to just turn the computer around, and we'll be right back. Hi, everyone. Welcome back. Can you hear me? Let me know if we're getting affirmatives. We good? Can you guys hear me? All right. Okay. This is the beautiful Sandra I told you about. And let's get a close-up of her eyes. If you can come in, Marcos, really close. Let me just get this little fuzzy out. Okay. So she has so much, she's just gorgeous. But you can see there's a little bit of her iris being covered by her eyelid. So we're going to put the Upneeq in. Have you tried Upneeq?
Once. Yes.
What did you think?
I liked it.
Okay.
Yeah.
Cool. All right. So we'll start with this. So this is one application, and they give you a little extra. And then a couple questions that are commonly asked. These are preservative free. So some people get allergic to the preservatives. So these do not have the preservatives in them. So even patients with sensitive eyes can tolerate these. Also, the vehicle, what they put the medicine in, is made up of artificial tears. And so patients with dry eyes can also use these. So it's pretty cool. All right. Now, I don't put these in patients every day, so we'll see. We're doing this on the fly. We'll see how this goes. All right, so, okay, open, please. And then just try to relax. There we go. And it doesn't burn. It just, it's just an eye drop.
Yeah.
Yeah, it's just like you're putting in artificial tears. All right, blink, blink, blink for me. Perfect. Amazing. So that was one drop in the right eye. And now it'd be kind of fun to do one eye versus the other, but
Yeah.
I won't do that to you. You got to go back to work, right? Although I guess patients aren't seeing you today.
True.
All right, blink, blink, blink. Feel good?
Yes.
Awesome. Okay, good job. So I'm just going to put this right here. Now let's go to our consultation part.
Mm-hmm.
You've been injected with Botox and filler before.
Yes.
Okay, everything's gone great.
Great.
Awesome. When was the last time you had filler?
January.
Okay, January. So we're looking at 8 months ago. And where was the filler?
Lips and cheeks.
Lips and cheeks.
Yeah.
And whereabouts on the cheeks?
Like right where you're.
Right.
Yeah.
Kind of like the
right
outer
there.
cheek.
Yep.
Okay. Okay, great. Have you ever had this part of your cheek done?
No.
That's so great. You've got great support here. I love that. And the fact you've already done your outer cheeks,
Mm-hmm.
I think it's perfect to just go right to the tear troughs. So we can do that today.
Great.
Awesome.
Yeah.
So if she had a really flat cheek right here, like mine's really flat right now, Dr. Yonen's got to puff it up a little bit, then I would probably start, even with her young age, I'd probably start with filler here. But she's already had filler here. She's got really great support here. Her ligaments that support the cheeks are very well intact. So I feel comfortable going ahead and doing filler in her tear troughs. Backing up a little bit, let's talk about Botox, Dysport, etc. When was the last time you had Botox or Dysport?
December.
Oh, okay. So it's been a little while.
Yeah.
Okay.
and frown for me. Okay, and smile. Okay, so we'll do a little bit there too. Any issues with Botox
No,
discord in the past?
loved it.
Okay, so today, because we're doing a demonstration on rejuvenating the eye area, we will just do here to lift the inner brow, and we're gonna do here to open up the eye and lift the outer brow. And we're gonna leave the forehead, and we're gonna see how much lift we can get by doing this. So if you could grab the, we're using Botox today, and then put it on the tray and move it close to me. Okay. Frown for me. Good, and relax. All right, so we will start with your frown lines, my dear. Close your eyes for me, and I'm gonna go right there. Pinch. Perfect. And right here. Pinch. Amazing. You feel okay?
Mhm.
Great job. Pinch. And frown. Good, relax. And frown. Good, relax. Beautiful. Okay, done there. So you can see how easy that is for the patient. Quick and fairly painless. Big smile for me. Great, relax. Awesome. Perfect. And then, awesome. This side is done. So I will have you come over here, Ellie, and hold pressure, glabella and crow's. Now I'm going to come to this side. Thank you. And smile. Good, relax. Beautiful. Beautiful. Quick and easy. Little brow lift. Literally, you guys, it's going to pick up her eyelid at least a millimeter. And it's like a little tiny natural looking brow lift. And it's 5 minutes, as you can see. So super, super awesome. And what do you think, Sandra? Easy?
Love it. So easy.
Okay,
No
awesome.
pain, nothing.
Yay. Okay, so now we'll do the tear troughs. And I'm just going, I always double check the cleaning. So I'm going to double check the cleaning here. Okay, that stool and the items over there are kind of like a fall risk. Please. Okay, so I use a very, very strict surgical prep for filler. The filler lasts so long that we don't want to contaminate it as it's going in. We want to completely clean, almost like a sterile surface. It'd be sterile if we were in the OR, but we're not in the OR. But we're pretending like we are, just to make everything as clean as possible. Thank you. And then I'll do one more after this. Perfect. So my assistants prep, and then a lot of times I'll prep again if I haven't witnessed them prep, just because safety is number one. Okay, so that's that. Now I'm going to raise the table just a bit. Okay, Restylane, please. I'm going to use a product called Restylane in this area. If she didn't have these beautiful cheeks, I'd probably pop a little Voluma in the apples of her cheeks. That's actually a really great way to lift and support the tear trough area. Open it. Okay. All right, Sandra. Look a little bit away from me. Close your eyes for this portion. Okay, so the tear trough area, we're really going to focus right in here. She's got a little bit of a line there and a little bit of shadowing.
So I use this thing called an AccuVein to avoid any blood vessels. Pinch, Sandra. Good job. So that helps reduce bruising and also makes it safer. And then do that. And you can take this box away, this too. Thank you. Okay. Now, here we go. This is something I do pretty much every day because it's such a popular request. Okay, Sandra, you're gonna feel a little push here. Don't worry, just a little push. Awesome job. That's pretty much the hardest part is for patients to feel that push. So you did amazing. Great, you doing okay? Okay, awesome. And sometimes, you guys, it doesn't take much to really notice a nice difference. Teardrops are one of these things that it's a little more advanced to inject just because we kind of undercorrect when we're doing the tear troughs. So when I use Restylane really attracts water. And so over the next 2 weeks, it's going to look even better. It's going to attract water. But if I put too much in today, it could almost look like too much. So it's kind of nice to have been doing this for years because I know exactly what this product's going to do and when to stop, basically. And you've never had these tear troughs injected before, right?
No.
Okay. How's it going, by the way?
Perfect.
Amazing.
Painless.
So you guys, she said before that she was nervous. So you can tell she's just like a natural here. Go ahead and relax. Good. Relax, relax. Perfect. Were you nervous about the injection or being on camera?
Both.
Okay. Well, I think you're doing great. Okay, good. All right. So let me have you just sit up for a second and we'll take a look at you. Okay, awesome. And then look straight at me. Good. Awesome. Can you guys see the difference? Look a little bit this way. Yeah. Does everybody see the difference between the two sides? And this is something that's just going to look better over time. You can see there's no black eye. There's no bruising here because I inserted the cannula here, which there's not a lot of blood vessels here. So very low risk of bruising in this area. Put your chin down just a little bit. Look at that. Gorgeous. Okay, go ahead and lay back. Okay. And it doesn't take much. I've only done, let's see, I've only done 0.3 of the syringe. So it's kind of nice what we can do with just a little bit of filler. Okay, now we're going to the other side. So keep your eyes closed for me for a second. And then here we go. Okay. Little pinch, Sandra. Perfect. All right, guys, this patient is just making it easy for me. You said you were nervous. You couldn't have been nervous. Okay, good. Relax. Don't smile. Perfect. Okay, here we go. Little pinch, push again. There we go. Awesome. That's the hardest part. Good job. And believe it or not, this is not a very sensitive area. It kind of feels weird, especially the first time you have it done, just because we're working around the eyes and it's just, we're not used to that. So it feels weird to us, but there's not a lot of nerves in this area in contrast to the lips, which can be very sensitive. But still doable. Little push here again. Sorry. Great job.
So I think everybody on the webinar deserves to gift themselves this package because it's such a great thing. Almost everybody can benefit. And if we don't put any in your tear troughs, we'll use the Restylane somewhere else. But it's just really a nice natural way to refresh. Okay, so just massage that in a little bit. Good. Do you feel okay?
Yeah,
Okay, awesome.
easy.
So sit forward just a little bit. Okay. So then look straight ahead. Yeah, great. Okay, go ahead and lean back. Awesome. So we have a little filler left. So I'm thinking I'll put the rest in your cheeks.
Yeah.
And that will continue to rejuvenate the eye area. If you can hold pressure over here, Ellie. Yep, God's right over it. Perfect. Okay, so this is fabulous because we still have a little bit left. We're gonna get a little lift in the entire face by using the rest of the Restylane in the cheeks, and it also will help the eye area because it will pull the skin taut around the eye because it will be more her skin will be more contoured in this area. So I'm gonna see how her skin wants to lift. Yes. Okay, here we go. Amazing. And a little pressure. Great job. So we've just got a little, oh, that's nice. That just perked your cheeks right up there. Okay, that was like 0.15. It was just a tiny little injection, but it still makes a difference. Okay, thank you. And here we go. Pinch. Okay, perfect. And will you hold pressure for me right here? Perfect. Okay, so we did the Botox, we did the filler, we did the upneak. It seems too simple. So I'm gonna adjust the table. We'll have her sit up one more time, and then we'll also look at her eyes and see if we see anything with the upneak. I don't even know if it's been 15 minutes yet, so we'll take a look and see if we notice anything. There we go. All right. Okay, so, oh my gosh, you look so great. Let me just do this. Ellie, if you could just still hold pressure on this one side, it's just being stubborn. Look how lifted her cheeks look. Look how rejuvenated the area around her eyes look. I don't know, I think your eyes look more open too. Take a look and see. And of course, the Botox takes 2 weeks to kick, or 7 days to kick in.
Oh my God. You can totally tell. You can totally tell. Look at that.
Yay.
I love it. Thank
You
you.
look amazing. You did amazing.
Oh
You
my
did
God,
great.
thank you.
Of course.
I love it.
Absolutely. All right, so she will look better in 2 weeks. We will post pictures.
Okay.
Thank you so much for attending. This is something that's so simple and easy, and I think it would be just such a great thing to do for yourself. So thanks, guys. See you next time.